Oh, hello. My name's John.
I'm Laura.
Laura. Okay, what can I do for you today, Laura?
Well, I woke up this morning and I blew my nose and there was just blood everywhere and it just hasn't stopped bleeding.
Oh, okay. So how many lots of tissues have you used?
I don't know, like 5 or something. It's just like been bleeding and bleeding and it's not stopping.
Okay. All right. Well, let me get you some gauze. Hang on, I need to grab some gloves. You just keep holding the pressure on. I'll get some stuff for you. All right. Have you had nosebleeds before?
Yeah.
Yeah. How often does it happen?
Whenever the weather gets really dry.
Oh, okay. Which is pretty often in this area, isn't it?
But after a while it comes good.
Yeah, okay. How long does it typically take to settle down?
Maybe a week.
A week? Okay, but it doesn't bleed for the whole week, does it?
No.
No, but each time it bleeds? You're talking about half an hour, 2 hours?
Nah, usually just maybe like 10 minutes and then it stops, but this time it's not stopping.
All right, take that one away. Look there. All right, oh, it's trickling there. Just open your mouth nice and wide. No blood clots. Can you taste blood in the back of your mouth?
Yeah.
Yeah, okay. All right, we've got to stop that because swallowing blood can make you feel unwell. All right. Feel there where I'm squeezing on the bridge of the nose? Yeah, so you're not trying to stop the nostrils, you're trying to squeeze the bridge of the nose like that.
Okay.
All right, I'll get you to do it because you can tell you squeeze as hard as you can without hurting yourself.
Yeah.
Because what we're trying to do is squash the blood vessels so it stops bleeding.
Okay.
All right, just let me take them away. Alrighty. So we'll try that. That works in most cases. All right. Right, let me look in our manual and see that we're doing everything right for your nosebleed.
Why do you have to look it up?
Oh, it's a lot like a pilot flying a plane, landing a plane. They've done it 1,000 times, but they still want to use a checklist to make sure they've got everything right. All right, you don't want to miss anything important, and it's good practice to do that in healthcare as well. So I always do that, even when I'm really confident that I'm doing the right thing. I always just double check against the checklist. It just keeps everyone safe. Make sure we don't miss anything important.
Fair enough.
All right, cool. All right, so we've got a few things here. It says that the bleeding is usually from the central divider at the front of your nose, which is what I showed you with the gauze. And it can be at the back of the nose, but it doesn't look like it is in your case. Okay, so what we've got to check, do you have an underlying bleeding disorder? So do you have a lot of problems with bleeding? When you get a cut, you bleed a lot?
No, not really.
No more than anyone else? Okay.
I don't think so.
All right, are you on any medicines at all, Laura?
No.
Okay, because some medicines can thin your blood, make you bleed more, and that would make nosebleeds more likely. All right, do you get recurrent nosebleeds? You said you got them a lot, didn't you, when dry weather? All right, is it every time it gets dry weather or just sometimes?
Just sometimes.
Okay, yeah, when it's particularly hot and dry.
Yeah.
Okay, that's fair enough. All right. Now, if it keeps bleeding after we pack it, but I don't think we're going to need to pack it at this stage, but I'll go through that with you in a minute. All right. And the other possible cause is a button battery in your nose, but I think at your age that's pretty unlikely, isn't it? Yeah, cool. Well, it looks like we don't have any of those urgent things that we need to do an urgent medical referral.
Okay.
All right, so we'll just keep that pressure on and we'll see if that stops it.
All right.
Right. There, so we can see it. Which one's your size? This one? Oh, just fits you. Almost.
Was it alright?
Yep, 140 on 90, which is pretty normal, and your pulse rate is also normal, so that's okay. So that shows that you haven't lost a lot of blood. It just looks like a lot when it's in those tissues, okay? But let's stop you losing any more, all right? Has that bleeding stopped? Is there anything trickling down the back of your throat?
I can still taste blood.
Yeah, that's probably what was there before. Just see, it's not trickling out your nose anymore.
I feel like I need to blow my nose.
No. Don't blow your nose for a little while, okay? I know it feels
It's
funny.
blocked though.
Yeah, it is blocked. There's a big blood clot in there. You'll be able to move that in a minute, but you need to let those little blood vessels close off first.
Okay.
All right, if you blow your nose now, it's just going to start again.
Alright.
All right, so you just need to manage that for another 15 minutes to half hour, and then blow your nose gently. All right, okay. Now, if the bleeding starts again, we may have to do something called nasal packing. Have you ever had to have nasal packing? No? Okay. I'll just show you. Hopefully we won't need to do that today, but I'll show you because, you know, if we need to do it, we need to get onto it pretty quickly. So if I show you now, then we'll all be ready for it, won't we? I'll just find it for you. Here we go. Nasal packing. There we go, 263. Here we go, nasal packing. So there's two types of packing. Can you see that?
Yeah.
Yep. Anterior nasal packing using Maricel, which is what we've got here in the clinic. And the really good news is that we put a local anaesthetic spray in your nose so it doesn't hurt. Okay? Feels funny. Feels like your nose is blocked, because it is. We block it with gauze. All right, and this is what it looks like. If you can see that, it's a bit of a small picture, isn't it?
Mm.
But what you do is you spray the anaesthetic in there so it's all numb, so it doesn't hurt. And then you have this paraffin or Vaseline soaked gauze, and you just put that in there, and then you just fold it in with a pair of forceps until it's all full.
That's a lot.
Yeah, it is a
Wow.
lot. It takes a fair bit.
Mm.
Yeah, but it's really effective. So,
So I've got to come back into the clinic to do that.
If it starts bleeding again and it doesn't stop with just a bit of pressure, then we may need to do that. All right. And then the other thing to let you know is if it keeps happening all the time, it's a really good idea for you to talk to the GP when they're out here and get a referral to an ENT specialist. Because there might be something they can do in there they can do some chemical burning inside your nose. And I know it sounds a bit awful, but that's really helpful. I used to get nosebleeds when I was young, and that's what they did for me.
Okay.
They did that chemical burning inside my nose, and I think what it did is it scarred up all those blood vessels, and now I don't get nosebleeds anymore.
Okay.
All right. Any questions?
No.
No. Okay. Well, hopefully it just stays simple and straightforward. But yeah, if you keep getting nosebleeds all the time, then maybe we need to get the doctor to refer you.
Okay. All right. Thanks.
Very cool.
Yeah.
All right.